Hi, I am Musa Raza, and I am the User Engagement Manager based in Pakistan with Zenysis Technologies. I am honored and pleased to be part of Global Digital Development Summit 2021. Today, I would like to walk you through our experience supporting Sindh's government from the start of the COVID-19 epidemic with reliable, integrated data that enabled them to weigh and make critical decisions about preserving human and economic life during a complex and evolving larger global pandemic. The balancing act: we were not only able to save lives but also livelihoods in Pakistan by implementing smart policies through utilization of accurate data. At Genesis, we have been working with Sindh's government since 2019 to support data-driven decision-making related to child immunizations. Despite this and other data integrations and modernization efforts across public sector, officials in Sindh Province recognized the need for technological assistance to effectively respond to the growing caseload, and we were right there for them. Let's take a look at the main challenges that we were up against at that time. Fractured datasets, varying data quality. I still remember those days, following up with each lab multiple times in a day for submission of timely and complete data. Trust me on this, every lab had their own data standards and parameters. The entire data structure was so messy that it took ages to clean up one type of data and present them as one picture. We were also following up and supporting these labs on testing equipments, availabilities, and enhancement of their capacities to conduct daily COVID tests. In the beginning, there were so many partners involved, and labs were confused to whom to share their datasets. There was a lack of trust between the partners. At the end of the day, these challenges meant authorities couldn't properly answer critical questions in a timely manner, like which hospital had reached capacity or which neighborhood represented virus clusters. In order to manage the virus and the economy without harsh blanket measure, they needed a quick access to the granular analysis. To help solve these problems, we worked with Sindh Province officials to implement a data analytics platform to give them real-time, accurate, comprehensive information to inform policy decisions. By integrating laboratory and hospital data, patient and caseload information, and critical commodity status, we developed a more complete picture of the outbreak. This enabled the development of micro-lockdowns across the province to mitigate economic loss to at-risk groups, thus balancing strong pandemic response and economic justice policies. We also improved data quality measures by harmonizing data sources on the Zenysis platform. As a result of the platform implementation and the insight it offered into the actual impact of the pandemic, our partners were able to enact smart and innovative policies and protocols to manage the crisis. We were able to monitor and assess the spread of COVID-19 pandemic across the province. We forecasted requirements and subsequently enabled the optimal allocation of medical resources to districts across the province. Implementing the platform has enabled government officials to identify opportunities for innovative policy making and data-driven decision-making to more effectively respond to the public health crisis while balancing economic concerns. Micro-lockdowns instead of widespread blanket lockdowns. Demand-led medical supplies, resources allocation. Over here, I would like to give you a quick demonstration how we were able to apply smart lockdowns in the province. Earlier, when the pandemic hit the province, the entire province was under the lockdown. But if we look closely at what's really happening in this province is that we had hotspots right here and a few hotspots here, very minor hotspots over here, and very minor hotspots over here. So this tells us that the entire problem within this province was in this part. And this part of the province is called Karachi. If we talk about Karachi, Karachi is the central hub for this province. Karachi accumulates up to 95% of the GDP for this province and up to 30% of the GDP for the country. So this important city is highly dense and it's very vital. If we just zoom down into this city over here, we see again that the hotspot is majorly in this part of the area. So what we were able to do over here is that we were able to see the cases. So all these dots are cases. And if we just so we don't need to apply any lockdowns in these particular areas. If we just zoom in and see where the case loads were, so again over here we don't need to apply any lockdowns. But if we further zoom in and see where exactly these case loads were, so we find more areas where we don't need to apply any lockdown at all. And if we further zoom in and see that, so this is the area which required a lockdown, but this area never required any lockdown. And moving forward, within this area, these were the areas that required lockdown, and these were the areas that never required any lockdown. So these streets were locked, and over here, decisions were taken. So we were not only able to, give them a status where they can lock down, but also we were able to incorporate all the groceries and the pharmacies. So a grocery store and pharmacy store coming over here, this need within the lockdown. So these stores really need to follow an SOP. So with the help of LEEs, a proper SOPs was set for these stores that at time only one customer will go inside the store, and they had a very limited time period that they will be open, and they were LEs were encouraging them, the customers, to go to these stores, neighbor stores which were not in the lockdown. Within these stores, the SOPs were one customer, as I mentioned earlier, that there should be one customer at a time. The customers have to wear gloves and masks all the time when they are inside the outlet. So I believe with the help of demo, you were able to understand how we were able to apply smart lockdowns. These smart lockdowns became more sustainable model and was scaled across the country. Today, effective use of data, robust disease surveillance, and well-understood trade-off have resulted in more responsive medical, public health, and economic policies that center life and livelihoods. It serves as a model of mitigation not only the impact of the global pandemic, but also other sectors, the crisis beyond COVID-19. And we feel honored that we were able to support Pakistan in harmonizing data collection, enabling application of government strategy to curtail spread of pandemic. So not only saving lives, but also livelihood in Pakistan through the Balancing Act. I hope you enjoyed this presentation. Thank you so much for joining Global Development Summit 2021. If you have any questions, please do let us know. Thank you.